Alright. Hey guys, I'm Harris James,
And I'm Chandler Weinberg.
and today we're going to be talking about Dr. Death and how Dr. Dunge's faulty performances were a result of poor risk management in the hospital. Dr. Death tells a story about an incompetent neurosurgeon located in the state of Texas named Christopher Dunch. In this podcast, they discuss his life story and how it led to his horrible spinal surgery career in multiple different hospitals in Texas. Even with just getting by med school, he was still profound enough to perform many botched procedures on patients with minor pains. However, these procedures led to patients having fatal injuries like paralyzation or death.
There are many signs that Dunch was an incompetent surgeon throughout his practice, but were overlooked. His botched practices would include leaving hardware or sponges inside patients, hitting major arteries causing too much bleeding, and even operating on the wrong area. Even outside of the operating room, people noticed poor cleanliness, drug abuse, and terrible communication skills. Overall, he was a little off, and it didn't seem like he was a knowledgeable surgeon and shouldn't be operating on any patients without oversight by another surgeon.
Dr. Dunch had been working at Baylor Plano Hospital where he had performed many of these faulty surgeries. During his surgeries, there were many witnesses of his odd behavior and wrongful procedures. Baylor Hospital knew something was going on, and instead of stopping Dunch from continuing to perform these awful surgeries, they just passed him on to other hospitals. Staff members witnessing his performance should have spoken up more often and pushed the fact that he was a bad surgeon and an overall terrible person. Doing so could have saved many lives, stopping him a lot earlier and prevented any lawsuits.
There are many lawsuits that could have come from these faulty procedures that have been performed by Dr. Dunch. Lawsuits filed from patients could have been placed against Dr. Dunch and the hospitals, the co-workers that have witnessed the surgeries and didn't speak up, or even the medical schools. In 2015, Dr. Dunch was arrested for 6 felonies of aggravated assault with deadly weapon. There was an ongoing investigation against the hospital for overlooking his performance after he was charged, but nothing ended up happening to these hospitals.
From a risk management standpoint, this could have been prevented in many ways throughout his career. One major lack of risk management practices we noticed was the hospital he visited and operated in. These hospitals have poor reporting, background checks, and overall recommendations for surgeons. After further research into hospital practices, we came to find 4 great risk management steps to implement with the hospital. These 4 steps goes as follows. Proactively perform risk assessment, hardwire risk mitigating practices, and prioritize tasks, and finally establish a just culture.
Proactively performing risk assessments would involve assessing risk ratings of procedures, products, and doctors. This could only be implemented by having correct and accurate track records of surgeons. By doing so, this can help these hospitals by solving this discrepancy issue between surgeons and their performances on their patients. With surgery being such a risky task that can cause a lot of issues with patients, these risk assessments should be a big priority for hospitals to follow for the safety of the patients. Baylor Plano Hospital did a poor job at this and refused to take these steps when dealing with Dr. Dunch, and this led to a lot of injuries to patients. There are certain ways they could have used risk assessing by looking into overall performance of procedures done by surgeons, by investigating infections, falls, medical errors, security, injuries of behavioral health, and patient handling. If they were to take these steps and been serious about them, there wouldn't be as many patients injured by the incompetent work of Dr. Dunch.
As for hardwire and risk mitigating practices, this would involve creating an organization-specific standard for procedures that would have to be followed no matter what. In other words, each employee, including surgeons, should be shown and trained to perform certain tasks in certain ways that the hospital requires. This would not only help a better flow of procedures in the hospital, but will allow a time period where certain staff could see whether or not a new recruit is actually as qualified as they say they are. This could have been implemented in any of the hospitals that Dr. Dutch performed surgery at, which could have allowed hospital personnel to witness and prevent him from operating on patients. A mock surgery of some sort showing Dr. Dunch certain specifics of the hospital would have given them a chance to see his poor performance and stop him before he had a chance to injure as many patients as he did.
Prioritizing tasks would involve the risk management employees and will help them with their very large workload. This will allow them to prioritize the severe and high occurrence risk first in order to complete all in a timely manner. However, we believe this could be implemented on employees working within the hospital to keep focus with their job, whether it is at work or in everyday life. Someone in this position has so much liability risk in their job, and every day at work they have someone's life at risk. A person like Dr. Dunch, who partied a lot and never prioritized his work, should not be able to work at a position of his level.
Establishing a just culture is a major step to take when practicing good risk management techniques in a hospital environment. A just culture involves the communication between staff members and risk managers about the possible risk associated with surgeries and anything on the premise. The way Dr. Dunch was performing should have been mentioned earlier and in a more serious manner throughout the hospital staff. If a just culture was established in these hospitals, there could have been major talk within the hospital about the risk he posed on patients. This would have given the hospital a chance to hear the truth of who he really is.
After looking into risk management practices that hospitals should take when dealing with their employees and patients, we have come to notice that the hospitals Dr. Dunch has worked for have failed to protect their patients. Justice was served for Dr. Dunch, but in our opinion, there should be a lawsuit against these hospitals who ignored the importance of safety dealing with their patients and the lack of investigation into the corruption of Dr. Dunch and his surgeries that went terribly wrong.